Thank you, everyone. Today we're going to be discussing the new life insurance benefit for CCPU healthcare fund providers. We're going to start off by introducing who we are, the team that brings you this benefit, go over some basic life insurance terms, and then jump into the two new benefits, basic group term and voluntary life insurance. We'll talk about how to get signed up for these benefits to ensure all the proper paperwork is done for the voluntary life insurance and address any questions you may have at the end. So who we are. We are Legacy Group Benefits, and we have partnered with the CCPU Healthcare Fund in order to bring two life insurance benefits from Guardian Life. Providers who are active and enrolled in the healthcare fund will receive access to these benefits, both the group and the voluntary plan. So, Life Insurance 101, some terms that you guys should be aware of. Life insurance is simply a contract that provides tax-free money if you pass away. The money that this goes to is referred to as beneficiaries. These are the people or the trust, whatever entity you'd like, that would receive the money when the insured person passes away. When you hear the word group, this is the CCPU Healthcare Fund paid coverage. All providers that are enrolled in the CCPU Healthcare Fund automatically receive this benefit as being part of the group. When you see the voluntary side, this is optional extra coverage that can be purchased by the provider. The premium is the amount that's paid to keep your life insurance active. So the premium is a monthly payment paid for by the provider for this extra voluntary coverage. Let's do a quick summary on the basic group term that launched January 1st of this year. So this is a $50,000 life insurance death benefit for all providers actively enrolled in the CCPU Healthcare Fund. What that number means is if you were to pass while you're active in the fund, the people you designated, so those beneficiaries, would receive a total amount of $50,000 tax-free. So this policy is paid for by the CCPU Healthcare Fund. And if you're a provider, as long as you are in the reimbursement program, you've actually been auto-enrolled into this plan. So what that means for you is there's no application, no enrollment forms, or anything like that needed. The one thing we do need you to do is a beneficiary form. So as we said earlier, the beneficiary is who receives the funds if you were to pass. So the beneficiary form is a simple contract that allows the union as well as Guardian Life to know where to send those funds. We'll have you fill this out, and we'll show a sample of this momentarily, and it's located on the CCPU Healthcare Fund website. We'll have you send that in, keep it on file. So whether you want to purchase additional coverage or anything at all, every single childcare provider that's active in the reimbursement fund would need to fill out this beneficiary form. When it comes to the voluntary group term, this is an exciting new benefit that starts July 1st. This is optional coverage that's available for purchase for providers, their spouse, married and domestic partners, as well as qualified dependents. So those are children that you're financially responsible for that are under the age of 26. These are those monthly premiums that are to be paid for by the provider. And this is not an auto-enrolled benefit. This is something you have to opt into. So application is necessary, and there's the possibility of underwriting. If you're familiar with life insurance applications, typically fill out a contract and then you do a medical questionnaire as well as sometimes a medical evaluation. This could be blood drawn, labs, things of that nature. We'll dive into the details of that momentarily. So providers have the option to purchase this coverage during open enrollment period. Group benefits typically have a window that's open, and because this is brand new, the window has been open May 15th through the end of this month, June 30th. That open enrollment period is for all providers that are already in the healthcare reimbursement fund. You have until June 30th to sign up. Otherwise, you do have to wait until the open enrollment period, that's the following year. If you aren't a member of the Healthcare Reimbursement Fund yet and are joining us today, we will have open enrollment periods upon your enrollment time during the reimbursement program. So what that means, if you were to enroll, say August for the CCPU Healthcare Fund, you would have a 30-day window to sign up for the voluntary benefits then. When it comes to the beneficiary form, we do want to highlight that it's not required for dependent policies, and the provider is always the default beneficiary. So this is that important beneficiary form that we need all providers to fill out. We can see here in this top red box that there's 2 group numbers. Every provider will need to fill out this form using the basic group life number at the top and fill it in the box below. The other red box that's highlighted here is where you'll check off the benefit that this applies for. Everyone will need to fill out this form and check off the basic life benefit. We can see here at the bottom the community property state. Since we're all here in California, there are communal property laws that are tied to marriage. So if you are legally married to somebody and you do not want your spouse to be the beneficiary, your spouse will need to sign this form at the bottom. This is acknowledging that they signed away their right as beneficiary. There's nothing wrong with that. It just does need to be notated for estate planning purposes. If you have any formal retirement accounts, 401ks, IRAs, the same laws apply. So let's dive into the details of voluntary life. We have the open enrollment period, as I stated, May 15th through June 30th. This premium will be 100% covered by the providers for this monthly benefit. I mentioned earlier the possibility of needing medical underwriting. This is where the term guaranteed issue comes into play. The CCPU Healthcare Fund has negotiated very high guaranteed issue rates for providers. We'll go into those rates in a moment, but what this means is no matter what your health conditions are, weight, any of those pieces, you will be able to get life insurance guaranteed. It's just based off of your age, and a premium will be applied per the benefit you choose. You also, as we mentioned, can now get this for your family. So you can only purchase the life insurance for family members that are eligible for the CCPU Healthcare Fund benefits. What that means is your spouse or domestic partner, as well as those children under the age of 26. Something very important to highlight is if you'd like to purchase coverage for your spouse, they can only get up to 50% of the benefit of the provider. So I'm going to give an example of that. So say I am the CCPU Healthcare Fund provider. I'm in the reimbursement program. I would like to purchase life insurance for myself and my spouse. I choose to purchase $200,000 of coverage for myself. My spouse now has the ability to get up to $100,000. So they can get up to half of what I purchase. The minimum amounts we'll see here shortly reflect those numbers. So if you want to purchase coverage for your spouse or your children, just know that you do have to purchase coverage for yourself as well. So how do you sign up for the voluntary life? We'll go through a couple easy step-by-steps, and we'll be here to help along the way. When it comes to the life insurance, the voluntary life insurance benefit, there is that application required. It could be located at the ccpuhealth.org website, or you can scan this QR code here. When you're filling out that application, it will have your basic personal information. From there, you'll need to choose your own death benefit option. So as the provider, you can purchase your insurance in increments of $10,000 with the minimum benefit purchase of $10,000. You can get total up to $500,000 of coverage. But this is where that guaranteed issue amount comes in. If you want to get coverage with no medical underwriting, guaranteed no matter what the situation is, you can get coverage up to $200,000. Anything over $200,000 up to that $500,000 maximum would require an evidence of insurability, which we'll go over here in a moment. But just note, no matter what the situation is, you can get up to that $200,000. Again, we want to note the spousal coverage. While they can get up to 50% of the provider amount, their guaranteed issue amount is different. So the spouse can get a minimum of $5,000, which is half of the provider minimum, up to $50,000 of death benefit at a guaranteed issue rate. Their maximum benefit purchase is half the amount at $250,000. I want to give an example here that we may run into. The provider chooses the max guaranteed amount. So I, the provider, choose up to $200,000 and choose the $200,000 benefit amount. My spouse can get up to $100,000 of coverage, but the point we need to note is that only $50,000 of that is guaranteed issue. The other $50,000 would need to go through the evidence of insurability process. The children are quite easy. There's really two options. It's not based on age. It's simply a $5,000 benefit or a $10,000 benefit. Just a reminder, if you want to purchase coverage for your spouse or children, you do need to purchase it yourself. And once you choose those options, the rate sheets to provide the price are on that website as well, the ccpuhealth.org. You'll see the left-hand column is the rate amount, the death benefit amounts, and across the top is the rate amounts based on age. When you're choosing your coverage, it's going to always be based on your own age as the provider. For an example of this, again, I'm purchasing for myself and my spouse. I myself, as the provider, am 39. My spouse is 45. When we're calculating these rates and looking at the chart, the rates are always based off of the provider only. So both my spouse and I would be considered the age of 39 when calculating rates. This is what that voluntary life insurance application looks like, that the QR code will take you to the website. You can see that personal information, and then the next page will take you to choosing your benefit amount. The next step is only required if you, as the provider or the spouse, choose a death benefit that's higher than that guaranteed issue threshold. This is the evidence of insurability form. Reminder, the provider can elect up to $200,000 without doing this, and the spouse can choose up to $50,000 without having to go through the underwriting process. If you do go through the EOI forms, you will now need to be approved. So depending on what you provide, there may be automatic approval at the time of submission. When you go through the EOI form, Guardian may let you know, congratulations, you were automatically approved for the benefit chosen above the guaranteed issue amount. Depending on the information you provide, there may be farther underwriting needed by Guardian, and they would let you know directly. I do want to highlight that you'll be providing medical information when completing these forms. This is not something that myself, the legacy team, or the CCPU Healthcare Fund would be reviewing. This is confidential information that goes to Guardian and their underwriting team. No information will be shared. This is more information on where to find that evidence of insurability, how to locate the forms, and this will all be located on the CCPU Health website as well. So this has been a popular topic. What happens if I leave the CCPU Healthcare Fund or if I'm no longer eligible with a qualified child? Do you keep the coverage? What do you do? There's three options. The first of being you no longer want coverage, you no longer have it. The second option is portability. So upon leaving the CCPU healthcare fund, the insured, the provider, as well as their dependents can take the voluntary term life insurance with them. I do want to highlight that all of these benefits are term life insurance. While you are in the CCPU healthcare fund, your term period is the entirety of your time within the reimbursement program. There is no age out or cancellation period. But as soon as you leave, there's a 31-day window that opens up for you to apply for your own term insurance coverage and to begin paying Guardian directly. This is no longer a plan that would be part of the CCPU healthcare fund. It would be an independent term life insurance policy. The new rate is determined by your age at the time of policy and would renew year over year. We need to note some age reductions that are very important. While there's no age reduction while you're a member of the group, upon leaving, coverage reduces 35% at the age of 65. This coverage reduction stays the same through age 69, and then your term period terminates at age 70. So what that means, as soon as you turn age 70, your term life insurance benefit goes away. This is not an exception. The third option we have is conversion. So as I mentioned, this benefit while you're in the union is term life insurance. But you do have the ability upon termination of the CCPU healthcare fund to convert your policy to whole life insurance. The same windows apply. You have a 30-day window to apply with Guardian directly and begin paying them directly, separate from the CCPU healthcare fund. Your new rate is determined by your current age, your insurable age. And now there's no age restrictions or termination. Your payment is month to month, the guaranteed same amount, and your coverage is guaranteed for life as long as you pay your premium on a monthly basis. If you guys have any questions farther about your benefits specifically to the life insurance piece, you can reach out to the Legacy Guardian team Monday through Friday, 8 a.m. to 8 p.m. via the phone number listed below, as well as the email. If you have questions to your own individual benefits when it comes to the CCPU healthcare fund, your application, health, dental, vision, any of those pieces, you can reach out to the CCPU healthcare fund directly, 8 a.m. to 5 p.m. Monday through Friday. Thank you.